Welcome. This is the South Florida HIMSS hosted webinar on RPA, Robotic Process Automation, and Healthcare. Our programs committee kindly set this webinar up, and we welcome you. My name is Kendall Brown. I'm currently the president of South Florida HIMSS. Just have a few words to welcome you, and then we'll get started as a part of the content of the webinar. If you're not familiar with HIMSS, HIMSS is an international organization of healthcare IT focused folks. It is an international organization, so it covers not only the US, but Asia, Pacific, Europe, Latin America, Middle East, and the United Kingdom. I think Canada is included in North America there as well. Within our South Florida HIMSS chapter, we have nearly 2,000 members. If you are not a member, I encourage you to become a member, and you can find more information on our website, which will kindly put the URL and the chat group. The vision and mission of HIMSS is there on the screen, and that's to realize the full health potential of every human everywhere and reform the global health ecosystem through the power of information and technology. And hopefully that's what we're achieving today through the content of this webinar. If you're not aware, HIMSS National will be hosted April 17th through the 23rd in Chicago this next year. Last year it was hosted in our home state in Orlando. So next year, HIMSS 23 we'll be here before we know it, and it's hosted once again in Chicago. It's been several years since they've hosted it in Chicago, so we hope to see you all there, and make sure you mark your calendars. A few things that South Florida HIMSS has going on. Our 5th annual Innovation Award is currently accepting applications. The deadline to submit is August 10th. The winner will be announced at our annual conference, Integrate, in November. And final presentations will take place in mid-October. I encourage you to have a look at what the Innovation Award entails and encourage submissions. We'll make sure that the URL for the Innovation Award is put in the chat as well. There are nice prizes associated to the Innovation Award. I believe registration to HIMSS 2023 is a part of that prize. So something that you might want to have a look into. Besides this webinar, we have 2 others scheduled throughout the summer as a part of our mentorship program, which is a new program that we've added to the chapter. We're hosting a couple of career and professional development webinars, quick 30 minutes, but great inspirational and great content. Our next one is July 15th with Sarah Richardson. She's the former CIO of Naples Community Hospital and an excellent speaker, good friend of the chapters as well. And then August 15th, our very own moderator and programs chair, Grant McGaw, will be speaking on personal brand. So 2 great webinars that you'll want to sign up for. Again, they're on our website. If you're a member, you receive our membership emails advertising these types of events. Also encourage you to connect with us on social media. We are on LinkedIn, Facebook, Instagram. We record these sessions like this one today and place them on our YouTube channel. So I encourage you to review some old webinars or former webinars that we've done, and Twitter, of course, as well. Thank you to our programs committee, Grant McGaw and Stephen Bronsberg. Sorry, Stephen. Is our South Florida HIMSS programs co-chairs. We have members a part of this committee as well, and we thank everyone that's involved and host these webinars and content. If you're interested in getting more involved in South Florida HIMSS, the programs committee is a great place to serve as a volunteer. And feel free to reach out to any of us on the board to learn more about not just programs, but any of the committees throughout the chapter. It takes an army to put these things together, and we appreciate volunteers, and what you put into the organization is what you get out of it. So we encourage your participation. which kind of covers this slide. We need your involvement. And special thanks to our annual sponsors that are listed here: Dell, KPMG, Rubric, Teletracking, Trim Micro, Pure Storage, Tonics. Thank you, Proofpoint. We can't host events like this without our sponsors. So sincere thank you to our sponsors. All right, so today's webinar is about healthcare and robotic process automation, which is an exciting topic. I hear about it through my day-to-day operations at Syntrack. Robots and healthcare are a hot topic. So we thank you to the panelists, Ian, Jason, Randy. And without further ado, I'll turn it to you, David, and we encourage your participation here. So thank you for joining today, and Dave, take it away.
Well, thank you so much, Kendall. The American College of Healthcare Trustees is very pleased to be co-hosting this along with the South Florida chapter of HIMSS. The American College of Healthcare Trustees was founded in 2013, and it has the mission of improving governance, leadership, and decision-making in healthcare. This photo that you see there to the right was the winner of a photo contest among the attendees at our Asilomar conference, and that was in Pebble Beach on Monterey Peninsula, and that was on health tech innovation. And I just mentioned that conference because we ended the lectures at 2 o'clock each day so people could walk on the beach and be mindful. And we reassembled for dinner and networking by the fire pit. And there are people doing business together now that never met before. And one of our values is transcending boundaries, transcending silos, and getting great ideas, getting people to collaborate. So we were founded in 2013. We have conferences. We've had 2 or 3 at the Johns Hopkins Mount Washington Conference Center, one in California, again at Pebble Beach, 2 or 3 at Washington, D.C., 1 in Philadelphia, et cetera. We also have remote learning. We're we're in the process of writing a handbook on healthcare leadership, and we certainly invite people to apply, and we would love to get more collaboration between informaticists, data scientists, and clinicians. Today we have one visionary, Grant McGaugh, introducing another visionary, Ian McCauley, who's a fellow of the American College of Healthcare Trustees, and interestingly, Randy Rao, who's a discussant and founder of One Pass Access, is also one of our fellows. Grant is a program director for the South Florida chapter of HIMSS, and he's a business development executive and expert in data center solutions, and has award-winning podcasts. So he's going to be introducing our keynote speaker, Ian McCauley. And with that, I'll leave it to you, Grant.
We can hear you. You're on mute, Grant.
I hope I'm not muted. Am I muted?
Now we can hear you.
Oh, great. I was trying to say, David, thank you for the kind words. They were very wonderful. And I like everything that you're doing, especially the collaboration with South Florida HIMSS that we can bring very impactful events to the market, and to give our community an opportunity to learn about certain technologies that are in the field on a national scale that we can take advantage of. So this is a great opportunity. All right. So I want to state the goals of today. You know, the primary goal of this webinar is to better understand how healthcare systems can take advantage of advances in robotic process automation to improve supply chain processes and efficiencies. Now, we will begin with our keynote presentation, and I will introduce Ian McKell, who has partnered with and consulted organizations such as IBM, Oracle, Bain & Company, McKinsey, NVIDIA, and Amazon, and brings deep expertise in AI and healthcare technology. He regularly provides market evaluations for global expert networks with clientele including Big 3 consulting firms, Fortune 100 firms, venture capital groups, and others. Ian has served as the principal investigator and sponsor of preclinical and clinical trials for cutting-edge technologies in life sciences. Additionally, Ian sits on the board of advisors as a shareholder of a telehealth company, is a fellow of the American College of Healthcare Trustees, and has managed budgets as high as $1 million for the development of human and machine resources for life science applications. Ian co-facilitates healthcare-related coursework at MIT on robotics and digital transformation in partnership with Emeritus. So let's welcome Ian McKell as our keynote speaker.
Thank you. Let me go ahead and switch to my screen. Just give me a second. All right, can you guys see my screen?
Yes.
All right. Okay. So first, I want to thank the American College of Healthcare Trustees, South Florida HIMSS chapter, as well as all of you who are healthcare professionals that have dedicated your lives towards such a worthy cause. My initial experience in the healthcare field started as soon as I could become conscious of who I was. My mother has sickle cell anemia, and so it's a rare blood disease that many of you may be knowledgeable about. And so because of that, I've had to be intricately a part of the healthcare system in many, many ways since I was very, very young. And so I've seen the ways that the healthcare system has evolved and the ways that it has become static in many areas. And so our organization, Infinite 8 Industries, specializes in industrial artificial intelligence as well as machine automation. And we really try to focus on near-term technologies that may not currently exist in a widespread consumer available way, but those technologies that are accessible to different systems if they do want access to such technology. And so it was discussed before about my background. I won't go too much into it outside of the fact that I do have additional experience with white hat hacking and penetration testing. And so from that, I also bring that perspective of safety and security to any technology that we're touching or handling. And so you've come for a discussion on robotic process automation. And essentially what you're asking me to do in many ways as an expert in these niche areas is to make recommendations, right? And that's not only what I'm going to do, but I'm going to tell you essentially how you can create smart recommendation systems. And you may create a smart recommendation system that has many different aspects to it, or you may create one that's simple. But in the medical field or in healthcare, according to the FDA, recommendation systems are not under their purview, right? And so you can make smart recommendation systems within your organization without having to go through all of the FDA protocols, although there is a guidance document that you can't go by. And so one of the first and most cutting edge applications of artificial intelligence that allows for many different processes and procedures to be automated is action-based event notification. And so many of you have cameras, security cameras in your home, for example, that are activated based on motion, right? And so a lot of times there's a lot of different things that will run in front of the camera or come within the camera's view that will activate it and produce a lot of false negatives. What we can do now with artificial intelligence is we can actually determine a specific event that we want to occur, such as the person picking up the trash, right? Maybe the trash man or woman, maybe they've been really sloppy, right? Putting your trash bins back, and you want to make sure that they do it the correct way. And so you could train this artificial intelligence to essentially determine that this specific occurrence, this specific instance of a trash person arriving in a trash truck and picking up the trash or removing it. And so instead of making it based on just pure motion, you can make it based on an event. So for example, if there's a person coming in that they may have a certain disposition, right? You can tell that they're in pain, and we'll talk about that as well. But these are specific instances. If someone rolls in and they look like they're limping, you could train the AI to essentially notify you that they may need a wheelchair, for example. And so you can maximize your resources by receiving notifications of unique events that are taking place at different places in the hospital or any type of clinical setting. And these events can be communicated via email or via text messages, et cetera. And so you really can customize what's important to your system, right? What indicators, what metrics, what events are actually and truly important to your organization. And so we'll look at a case study. This is our AI physician, Forever. And essentially it's a recommendation system. And so we're going to use the case study of an emergency room camera analyzing an incoming patient and estimating a number of different predictions based on that patient's disposition. And the highest of those recommendations would be pain in this particular instance. And upon confirmation by a medical professional, a physician in this instance, additional staff, additional personal protective equipment is given out, and narcotics are deployed. And so you can customize your system based on different events, and it's completely possible to ensure that different resources are distributed in a way that is efficient and not overly burdensome on your staff because of the automation. Another area that has gained a lot of traction and a lot of interest as of late is using artificial intelligence to manage and optimize inventory. And so in this particular example, we're looking at an object detection model, which essentially can pinpoint using pixels, for example, where a particular object is at in a scene. And so here you can see that, for example, it's highlighting bottles. It's telling you where a bottle or a object has been misplaced. It's telling you where an object is out of stock, et cetera. And so you can train artificial intelligence on your unique products. And so if you have inventory, for example, and you know that you guys use this and utilize this all the time, this is in your warehouse, you guys are going to switch inventory at any point in time, then you could create a machine learning model specifically for your inventory and your organization. And the technology exists to be able to rapidly train new models whenever new inventory comes in as well. In addition to just using camera imaging to track inventory, there's also the option and opportunity to utilize robots in order to optimize and to track inventory. And so with robots, you can cover various areas, whether the area is a large warehouse or whether it's a smaller area, maybe a clinic, maybe you guys have a space for medical equipment, et cetera. Also, there is a market, right? There is a market for this technology. And so because of that, it's unlikely that you would have to go back and do any type of reconfigurations for a new type of robots or an entirely new market. So this market is pretty solid as far as that's concerned. They're using these type of robots in a lot of places like Walmart, for example. During the night shift, they're utilizing this in order to track inventory. And so what this does is it frees up more hands in order to utilize towards customer service, et cetera, and making sure that the overall customer experience and the customer journey is what more hands are actually able to be utilized for. We briefly talked about SMS services, and some of your organizations may already be utilizing this, but I say this more so to integrate this with the Internet of Things and to integrate this with artificial intelligence and computer vision. And so if you take these text messages and you integrate them with action-based artificial intelligence, for example, then you can really make sure that you get messages when something specific happens, as opposed to getting a lot of negative flags. Also, you can utilize this with IoT sensors. And so if you have sensors on different places, for example, to monitor the temperature, to monitor, for example, the heart rate of an individual, et cetera, you can get notifications, for example, if the heart rate drops below a particular amount. And so, yes, you can hear that, people around the room, the operating room, for example, may be able to hear the alarm go off. However, the doctor may actually be far down somewhere else in a break room, right? And he can't hear it, but he would be able to get a text message immediately and to know that the heart rate dropped below a particular amount. And so that could very well save lives. And so different sensors, we talked about temperature, but also IoT sensors can be utilized, as well as cameras can be utilized to determine if something is out of stock or to estimate how much stock is left, so that you can order enough, but not too much, right? And you can be more accountable for your resources. Also, you can specify who receives these messages, and you can customize these messages as well. So don't think that this is just something that's far off, that you have to go and pay this large company in order to do. There's more niche products that you can utilize in order to create these type of workflows for your organization. We talk about RFID, or radio frequency ID chips, and also alternatives. And so these are popular because of their size, and you can place them in a myriad of different ways. The retail industry is well known for utilizing this. Whenever you walk out of a store and they haven't changed the signature on the device to notify them that you've actually paid for it. The popularity, like we discussed, is mobility, but I also will touch on not only that, but I'll talk about the Pi Zero, right, which is more of an embedded system. Now, with the RFID chips, they operate essentially off of a firmware-based system. And so as a result of that, without going into detail, it doesn't have the type of cybersecurity tools that a embedded system would have that can actually run a light operating system. And then you can also install different cybersecurity tools on that light operating system. And so the Pi Zero allows for more security than an RFID chip would. However, it's clearly not as small. It's about the size of a stick of gum, but it is not as small as your thumbprint, right? And so that's the trade-off between the two. But at least you understand for your particular use case, maybe security isn't as big of an issue. Maybe for another use case, you don't mind paying a little bit more to have enhanced security. Next, we'll talk about process automation utilizing smart contracts. And so essentially with smart contract, you have two different parties that come together to form some type of agreement. And the agreement, once the terms are met, the agreement is executed automatically. It'd be like, for example, automatic invoicing, right? You could have automatic invoicing through a smart contract. As soon as the patient leaves, and signs out, for example, a contract could be initiated that would automatically process an invoice, right? So little things like that could be automated within an office. If you think about any type of transaction, any type of documentation that's signed and executed upon, any type of exchange of value, right, and services, there is a smart contract that could facilitate that and could automate that to where paperwork is not necessarily needed and all hands are free and individuals and staff can focus primarily on patients. There's different things you can do with these tokens. You can create reward programs in order to incentivize patients, for example, to come to get their regular checkups, right? And as long as these tokens are utilized within your own ecosystem and they're not put on an exchange and individuals can't just purchase these tokens without receiving your services, then you are safe from the Securities and Exchange Commission from that particular regard. I will say that they do have new regulations that are coming down, but at this point in time, it's just like a rewards program, like you going to AMC theaters and getting extra points for buying a large popcorn, right, and a soda. Also on top of that, outside of workflow automation, which we talked about, you can automate and record inventory and definitely manage inventory that way. There's enhanced security and accountability because there's a ledger, which that's essentially what the blockchain is. It's just a ledger. And in sequential order, you're having these different points of information that are recorded on that ledger. And anyone at any point in time can go and look at, the different transactions that are taking place. And it helps for accountability. It helps, in order to allow individuals to be able to go in there when they need to in order to get information. Also, that goes for the patients. The patients also have more accessibility when you're utilizing some type of blockchain-based system. We'll talk about speech recognition interfaces. And so there is an ability for anything that essentially a machine can do, it can be initiated through speech. And so you may think about a million different things that you do throughout the day that, man, if I just had a way that I could tell the computer to do this and it would just do it, that can be done, right? It's completely possible to do. And so, when you think about your Siris and your Alexas, that technology is completely available to you. It's not this unique thing that only a few people have access to. So there are different processes that, for example, if you're a surgeon and you want the screen or for the program that you're using to change or manipulate in a certain type of way, you could do that with speech recognition. And so just think about that. I'm not saying this for a particular use case. I'm just giving you access to the technology that's readily available for you to innovate within your field and within your locality. So this is just an example of Metaverse projects that our organization is working on to give you an idea about the type of things that you can do. So on the left-hand side of the screen, you'll see our Infinite 8 training headquarters. And so we essentially have an entire school in the metaverse that's complete with the basketball court, all these different things. We have rooms for workforce, we have rooms for K through 12, and then we have a room for pre-K as well, as far as training is concerned. On the right-hand side, you'll see a project that is currently under construction, and we're building a joint industrial park for Infinite 8 Industries, which is the artificial intelligence and automation company. And then we have the Quantum Coin Foundation, which is related to our cryptocurrency. And so we're building this joint industrial park in order to enhance the collaboration as we link artificial intelligence and blockchain together and we look at the type of things that we can do when those two technologies are combined. And so when we think about this, I automatically think about outpatient services and clinics. I think about patient tourism, because you wouldn't have to just service an individual within your locality. You could service individuals all over the world through this particular application. With the type of technology we use, it's not only based on having a headset. This can be accessed with a smartphone. And so you can go into a metaverse world using a smartphone, and you never have to have a screen wrapped around your face all day. And so this makes the metaverse completely accessible to billions of people around the world. There are cybersecurity risks with every new technology there are, but at the same time, one has to be mindful of the benefits as well. But I bring this up because the more points of access that you have within your organization. So if you go from 100 computers to 100 computers plus 900 IoT devices, right? Then you just increase the number of attack surfaces in your organization exponentially. And so that must be thought of and understood. And there are ways to mitigate this, which I won't go into here, but there are methodologies and best practices that can be followed in order to mitigate these type of systems. I'm currently authoring for an organization, I'm authoring a course right now on securing self-driving vehicles. And they use essentially the same technologies, right? They're just utilizing, the brain of a computer in a self-driving car can be used as a medical device in a hospital, right? And so the technologies are very much interrelated. And so I just want to put that out there so that individuals are well aware, because hospitals are targets, and you want to make sure that your target is minimized. And so that's pretty much it. Thank you guys for having me. If you guys have any questions, I would love to answer them and respond. Otherwise, I'll give it back to Grant, and I look forward to enjoying the panel.
Absolutely. First of all, Ian, thank you very, very, very much. Highly enlightening. I think I said that. It is lightning, really. That's really a little thunder and a little lightning bolt, because you're talking about all the latest technologies that we're hearing about all over the place, whether it's machine-to-machine learning, whether it's IoT or IoMT, right? Where you're getting into artificial intelligence, going into now blockchain ledgers. All of these things are coming together to build out a completely new infrastructure ecosystem, right? So instead of asking you a question, I'm going to bring up our panel and begin talking to them, because I think they have some questions. All of this comes together because automation and AI success basically begins in choosing the right processes. And then what most organizations are going to ask, what is the potential cost savings in implementing, through the supply chain? So I like to see that we get Randy and Jason to come off screen, come on screen. Let's get you introduced and get into this discussion. How about that? All right. So, and then you can stop sharing your screen at this point, Ian.
Okay.
Yeah. So Randy Rao, he's the president of OnePass Access, a forward-thinking innovator with 20 plus years of experience throughout the different industry segments of healthcare. That includes healthcare, supply chain contracting, procurement, and contract deliverables such as business relationship management tools. He's also into healthcare business buyer and vendor supplier seller static business information exchange and process automation. So we're going to hear from Randy here in just a moment. Then we also have with us Jason Werleman. He's the Vice President, Global Services and Process Industries at UiPath. He has 10 plus years of organic experience in delivering a combination of process and digital innovation horizontally across healthcare. So thank you both, gentlemen, for joining us with Ian. Now, my first question I'd like to ask, after both Randy and Jason, you heard what Ian just talked about. He laid the fabric of what the landscape and the ecosystem is going to look like from a digital transformation viewpoint. And I know we're talking about supply chain. You guys are supply chain experts. You're at POTH. You look up robotic process automation just in Google, you guys are going to pop up. So we've got some good experts here. So my first question is going to come from you guys. What questions do you have to Ian about his presentation that you'd like to elaborate on?
Jason, did you want to go first?
No, go ahead.
I think with my background a lot in the supply chain and processes, everything, if we're looking at COVID right now and the pandemic and everything we went through, one of the things I really like about, everyone will probably hate saying this about the pandemic, but it really thrust us into innovation time. You know, there was a lot of things out there that we had available to us, telehealth, different things that we haven't embraced until we really had to with COVID and look at better ways to connect. So a lot of the things that Ian's bringing up, I think is very valuable and important. A lot of my background too is based on what innovative technology do we have coming through right now. Looking at a supply chain and materials management aspect, how can we automate some of these processes as well? Even looking at the vendors that we have and the new vendors coming on board with innovation technology. I guess my biggest question for Ian would be like, from a supply chain aspect at like a larger health system and going all the way down to ambulatory surgery center, physician practice, as you're bringing in the machine and robotic aspects into inventory tracking management, what does that look like to a health system? You know, implementation process, how does that work for them? And then my second question would be probably about the RFID technology. I love that aspect. How would you wrap that into inventory control and what products are going into each different patient room and a billing cycle management?
Absolutely. So great questions, Randy. Essentially, there's a number of different vendors that, you know, either you can create something custom or there's enough stuff that's out there that you can white label and get off the shelves in order to essentially connect all your different devices, your IoT devices. It could be a RFID chip, or it could be any type of embedded system, really anything that you could think of, because there's just so much that's out there. But essentially, the main point is being able to locate items when you want to and when you need to, and to have information that's actionable information about those particular items. Like, for example, if you're transporting a vaccine, for example, in a refrigerated container, and you want to know what the temperature is at all times. So those are some of the things that you can do from an implementation standpoint. Basically, what different software suites or custom suites allow you to do is to create essentially a dashboard. And through that dashboard, it will give you all kinds of different information via APIs that will tell you about where all your stuff is, right? And the condition of your stuff, right? From that particular perspective. But the interesting aspect is when you bring in actionable artificial intelligence, and then you look at your people as an asset from that perspective, as well as your clientele, then at that point, there's all kinds of ways that you can integrate. But essentially, all these data points can be integrated into one dashboard via API. As far as implementation of that, you know, that's where you can do a strategic action plan. You can do stakeholder analysis matrix. You can do a feasibility study or a white paper. So there's a lot of different things that you can do in order to analyze it. You can utilize the lean business model process for a new technology to see if the patients will react positively to it. There's also the SBIR, the Small Business Innovation Research programs, and the STTR programs for technology transfer. So you can utilize these programs and go to one of the 11 agencies through the federal government and get them to actually pay for it. And so there's different ways that these institutions could go after it and do it with low cost.
Man, that was a great answer. I'm glad we have that recorded. So we're going to focus now with Jason. because you do a lot with UiPath. I mean, you're knee deep into the RPA world. And given this current discussion, I'd like to get your viewpoints on what we're talking about, and then any additional questions you'd like to ask.
Yeah, and thank you for having me. I appreciate the HIMSS Florida chapter and all the HIMSS chapters. I really enjoyed the conversation. When we look at robotic process automation, we're just talking about software here, right? We talk, when Ian was talking about all the technology, he gave a really great cafeteria of new technologies that every single organization here should think about adopting. It's not a necessity of, do you have the money and it'd be great to have? It's kind of the course of the way the world is going, right? When I think about processes like supply chain, and I lead healthcare, so I look at the whole enterprise. Supply chain obviously is an important aspect, and so is things like clinical outcomes and just the abrasion of the world right now. The reality is we don't have enough people doing the work that we need them to do, and we're not going to find those people, right? So when I think about these technologies and I think about supply chain, it's really required to keep real-time inventory to be able to do level loading, to make sure that we have transparency into things that are going on. You can talk right now about sensors, right? About transporting vaccines. Why is this important? If it's left outside in the cold, those vaccines are no longer good, right? Like those sort of things are trigger points that right now are problems. But in my world, right, and when we look at software and robotic process automation, it's how can we get to some of these outcomes practically without making massive investments of trying to bring my investment in 3 years down to investment in 3 months, right? We need these technologies, but there's a lot of ways of getting to some of this transparency to optimize the processes, to improve the way that our people do work, to get our business ready to absorb a lot of these technologies today. So it's a bit of a different approach, and it's a different thought pattern about software versus technology and hardware. But today, when we look at healthcare organizations, that's what we're looking at. And I guess from a technology point, Ian, from a supply chain, you just talked about how to alleviate that barrier to entry. If an organization like a local, I don't know if anybody's a Baptist from here, but if a Baptist decides that they want to invest in AI, they want to revolutionize with IoT device tracking, there's a lot of innovation that I'm sure that they want to incur. What would be your recommendation from a step-in approach? Because it's hard to do all of it at the same time, right? What is step one to start innovating towards that path of really being an innovation leader?
So I would say there's a couple of different paths. One is internal and the other one's external. If you want to stay internal, right, you can easily find a leader within your organization that will want to pick up that artificial intelligence, IoT, medical device flag. They're there within your organization, I promise you. And so if you give them that opportunity to kind of go outside of the box and then bring back what's awesome and what works, then you're going to have a leader, and you're going to have someone that's going to be dedicated towards the organization as well. If you want to do it from an external standpoint, I think one of the great things that an organization could do is to create a community of entrepreneurs, right? Maybe you create a startup competition, and that startup competition, maybe the reward is just to collaborate on research. There's no promises of dollars, just an opportunity to work together. And at that point in time, you could essentially tap into a bunch of talent and a bunch of ideas at one time that are centered around whatever your organization wants. And what they call it is a reverse pitch competition.
That's right.
So you already have the idea and the concept as far as what problem you're trying to solve. And then you're basically just crowdsourcing the ideas from entrepreneurs and then just rewarding the best one. And so that's an easy way that organizations could source and then also get the talent that knows how to implement whatever the great idea is.
You guys mind if I?
Question from the audience. And this was going to Jason, but you can all round robin into it as well. And this is from Lisa Fitz, right? And Lisa says, how far down the path do you think the average rural community hospital is with leveraging RPA in their organization? I think that's that cost of entry we just talked about. How, nobody's got, millions of dollars to lay around, but if you've already got some kind of technology there, and like you said, Ian, maybe that you've got somebody that wants to take on that responsibility and do that assessment work. How would you guys want to answer that?
Do you mind if I touch on that one? Because we have a couple of hospitals coming on board that are rural critical access hospitals. So some of them are independents. And I think what they're looking at is right now they can no longer afford to do everything on an antiquated process or by pen and paper. They do have to look forward to some of these automated processes to save on staff bandwidth and what they're doing. So it's kind of the other direction. If they're going to keep the hospital open, if they're going to continue to support their community, they need to move forward into the century. I mean, I hate to say it, but they're understanding that more of that value, and they're looking for better processes, and they're looking for faster ways to do that. And that's just my opinion with, the different rural critical access hospitals we're working with. I think there's a much higher need because they don't have all the staffing bandwidth that a larger health system may have. So they have to create better processes and better automated technology to keep up with the other organizations out there.
Excellent. And Jason, you want to chime in?
Yeah, absolutely. And props to Rob. Great use case here. I agree 100% with Randy. I would say that pre-COVID, which we should totally create an acronym for, by the way, we still had them do a lot of education and convincing. People understood the value of robotic process automation, but felt, I can't do it. I don't have time for it. I don't need it. And of course, that's reversed as skills tightened, as we started seeing, especially the reduction of skilled administrators. The rural hospitals and practices are the ones that are getting hit the heaviest. They're leaving the profession and not coming back. It's not like they have a pool of resources. They can hire a staff augmentation and they're great, but $350, $400 an hour, it's not so easy to keep going. So automation is not a hard sell point once you do the math of it and look at things like quality, look at things like control and patient safety. It's all there. The biggest issue is change culture and availability. That's really the biggest impact. When I talk to smaller rural organizations, I say, what is your propensity of adopting technology? Do you have people available? And do I need you to teach you how to fish? Or do you just want me to hand you the fish? I know that's an odd metaphor, but it's really the scenario to show success. If I'm looking at a small rural hospital where we've had massive change turnover and it's all new people, they have a 400% rotation, I'm probably not going to be successful of teaching that organization how to build an automation program and make it stick. So I'd have to approach it in a very different way. An organization like Randy's or an implementer or a few people that really know what they're doing in the Florida region to come in there, stand it up and run it for a short period of time, teaching them how to fish, how to build a culture. It's not like any other technology. I mean, if you think about the induction of the EMR, right, which we all either love or hate, probably a combination of both. Think about what that took originally when that started becoming mandated. It was a huge lift for the whole enterprise because it had to do with the way we did work and the way we built processes. So it's a very similar allegory. I'm pretty sure a lot of rural hospitals did not have the staff to implement the EMR like they wanted to, 2 decades ago. So that's really where we are in the current state of things.
I like where you're going with that thought. And the reason why we got EMR, EHRs into our hospital systems because the government helped out. There was subsidy. They paid for a lot of that, and that opened the door. I think the things that Ian was talking about, knowing where these programs are. Here's the deal. Just like Randy talked about, you can either stay on a 56K modem to access the internet, or you can go high speed. You'll never get into a metaverse world on a 56K modem. You're not going to be able to utilize these technologies, and you're going to lose significant value. So I don't think you have a choice in this matter. It's just a matter of how you're going to approach adopting the technology into your organization. So the question goes back to Ian, and from the audience, I'm going to read this. This came back, I think that's from Terrence there. And he asked, what are some of the liabilities? And I think you touched on it. What are some of the liabilities that could come across with that fabric that's exposed from an IoMT standpoint? What is that going to really look like from HIPAA compliance and other regulations? Would that impede the adoption rate of RPA?
So there's different things that you can do. So for example, when I used our technology for essentially remotely screening a person for COVID-19 using a selfie, when I did the clinical trial for that, I created a open source electronic medical record system that was based in the cloud. However, it was a local system that could only be accessed locally. And so that's how we got through the HIPAA compliance. And so you can build your own cloud locally for your own institution. Or if you do have access to some of the larger vendors, you can make it HIPAA compliant by essentially making it so that certain computers within your institution have special keys that only allow those computers to access those cloud resources. And so there's ways that you can essentially try to lock down and to mitigate any access from malicious actors into your systems. But like I discussed, you do have the other aspect of the more touch points that you have within your organization, the more liability you're ultimately going to have, and the more access that or attack services that a potential hacker may have. However, one thing is that a lot of times it's not necessarily a hacker that creates a vulnerability for an organization. It could be a lot of times through people, right? Like, so I could walk into an organization and say, hey, I had an appointment with so-and-so. I just need to finish up my presentation really quickly. Can I use your internet? And then boom, now I'm on the internet, right? And I'm all in the system. So a lot of time it's people, right? And it is culture and making sure that everybody's on the same page. But one thing I wanted to touch on as far as what Jason was saying is that I also think it's important, if you're going to create a program for robotic process automation internally, I think it's important to try to have some type of contest or something that will involve the employees where they can innovate. Maybe you already know what you want to do, but it would be awesome if you allow the employees to come up with the same idea through some type of competitive process, and then allow them to essentially buy in themselves to the robotic process automation. And then that way we're not pushing anything on them. And it's an idea that they came up with that they'll have more enthusiasm to actually implement.
Yeah.
Do you mind if I add on to what Ian's mentioning here as well? I think that a lot of things that we have to consider is, number one, if we're looking at a new technology or if we're looking at a new process or strategy as a business, right now we have a lot of AVAP, value analysis teams that are with the health system, wherever they're taking an all-inclusive look at what's the strategic alignment. And then usually this is made up from multiple departments. So we're having clinicians, staff education, infectious disease control, supply chain, CFO, and we're bringing all these leaders from different departments, as Ian's mentioning, into this one group as we're doing an assessment. How are we looking at this all-inclusively? Bring in supply chain, was not. And I love the innovation tracks to how can a health system partner with technology out there to develop out a program, and how can this be done as beta tests completely believe in that. So I think there's a couple of different platforms that we can look at on how to introduce technology and get all of our different departments buy-ins. So they're having a say. And we're going to roll this out, and we're having a much broader look at this as an entire design.
And just to add on to that, and I think it's an important point that everyone's making, is we're seeing this move. Healthcare is making a move to consumerism, right? We want to be more transparent, more active to our patients, to our members, to our constituents. Technology, like the ones we're talking about here, is moving in the same direction, right? So it is important to have the business user. Most of these technologies are governed by IT, but managed by the business. 10 years ago, you could have never said that. I mean, I've done a lot of BPM transformations in my lifetime and been on complete technology teams, and there's one business person, that's your product champion. Now it's all business people, and there's one IT person making sure the implementation goes well. This is a shift. And especially with process automation, I mean, most of my customers that are users are not from IT. They are from the supply chain business, VP of supply chain practitioners. They're building, and this is an important part, they're building the robots, they're implementing the robots, they're co-sharing. We call this program citizen development. The citizen is everyone here on the phone, on the webinar today. So when you can democratize these technologies, so you're a part of the process, not a receiver or user of the process and technology, that really changes the landscape. Can you all remember the day that you moved from the ticker tape to Excel workbooks, right? That sort of innovation and transformation changed the way that the workplace operated. These technologies that we're speaking of do that today. It's really that second or third coming of Six Sigma thinking, of global business process optimization. So, when Ian and Randy talk about doing hackathons, they, kind of these workshops to bring in ideas, to be able to ideate, prototype, and actually put it into production within weeks, really changes the adoption than what we probably would have witnessed a decade ago.
And this has been a phenomenal conversation. We're coming to the close of our session. And I encourage everyone who is tuned in to this particular discussion that you challenge yourself with your understanding, where you're at as an organization, where you want to go. I think all of us are going to be challenged with adopting new technology, just like we adopted our smartphones, just like we adopted faster internet access and the internet itself. We are on a journey to a whole new environment. And we don't want to enter it with fear, meaning fear becomes the inhibitor. People are like, oh, wow, this is going to replace me. No, this is going to augment you. If you look at Jason's background, he's got some augmented reality. Everyone's like, what is that flying around Jason's head? Well, that's part of the technology that we're living in, that our digital world is, from a device standpoint, it's going to be more accessible to us in the physical world. So it's not replacement, it's enhancement. So with that said, I want to thank Jason, Randy, Ian, and David for being our guest on the South Florida HIMSS chapter. This has been wonderful as we wrap up our year of events. We've got Stephen Brownsburg here from Nova Southeastern University. We're going to be at his location for this innovation, but then we have the Integrate session that'll be in November. We're going to have some great speakers. So if you know any other great speakers, let's talk about that and see if we can get them involved. So I'm going to hand it over to Kendall to go ahead and close us out. Thank you.
Thanks, Grant, and to our panelists and our speakers, thank you for your knowledge and sharing your words of wisdom. Robotics in healthcare is a big deal, and as Grant said, it augments the work that we do. We look forward to hosting further webinars. I noticed a lot of you are not members of South Florida HIMSS, so we encourage you to become a member so you can find out about future events like Integrate, our annual conference that draws over 300 people to discuss health IT topics. Thank you for your time today. If you have any questions about South Florida HIMSS or want to be more involved, please reach out to any of the board. I encourage you to go to our website and follow us on LinkedIn. Thank you and have a good day.
Thank you.
Thank you.
Thank you.